So where are we right now? We are February the 25th, and the latest stats are that in the UK, 18.7 million people have had their first dose of vaccine, and either the Pfizer or the AstraZeneca vaccine, and just under 800,000 have had their second dose. And just as a quick reminder, we've got 9 priority groups, and the first 4 groups were all offered vaccines, and the vast majority of them received them. And those first 4 groups, just as a quick reminder, I know that hopefully this is all sort of second nature to you now, but just to remind you, they were residents and care homes of older adults and their staff, people who are over 80 years old, 80 years and older, and frontline health and social care staff, people over 75 years and people over 70 years, and the clinically extremely vulnerable. And that is thought to have, those 4 groups are thought to have accounted for 88% of all COVID deaths to date. So we are now looking at groups 5 to 9. So we're going down the age groups. So we're going from 70 to 50. It feels like I'm sort of doing the top 40 charts, but we're going from age 70 down to age 50, plus people with underlying health conditions. And it's anticipated by late spring, we should be looking at having got through those 9 priority groups. I mean, there's a lot of ifs and buts there, but that's sort of the general guideline we're looking at. I know there are some questions coming up tonight about prioritising groups, and I know Bruce in particular has got a question in about people with disabilities, so I won't go into that now. Suffice it to say that once we've got through those 9 groups, then there are conversations ongoing about how to prioritise the rest of the wider general population. And I'm sure you've heard conversations, you've had them yourself, about whether we should prioritise teachers, whether we should prioritise the police, and all those are really worthwhile conversations. I just wanted to give you a quick snippet from the Joint Committee on Vaccine and Immunisations, and the committee that provides independent advice to the government about how these priority groups are set. And just to give you a bit of an insight, because their advice is that first priorities for any COVID-19 vaccination programme should be prevention of COVID-19 mortality death and protection of health and social care staff and systems. Secondary priorities include vaccination at those who have increased risk of exposure and to maintain resilience in essential public services. So that gives you an idea about how people are thinking about these priority groups when they're setting them. So what impact is the vaccine having? Again, I'm sure you've all heard this on the news, but just to recap, and I'm sure you've seen Patrick, Chris, and Jonathan Van Tam do these graphs, but hospitalisation and death rates are falling, particularly in the over 80 age group, which gives us the first indication that it looks like vaccinations are reducing hospitalisation and death. It's still early days with the stats, so we need to see more statistics, but that looks positive. We're also seeing preliminary evidence that vaccines are looking like they reduce COVID transmission, which is interesting and great. Again, still preliminary, so we need to see more statistics, more evidence, and we'll be able to report back on that more in the future. We also need to be aware that even though the vaccine is one very important, excellent thing that the NHS is doing, we still need to be aware of the restrictions that we have on our lives and the importance of maintaining infection control for all of us. So the importance of maintaining very good hand hygiene, the importance of social distancing, wearing masks in public spaces, that we're going to lift those restrictions slowly. The government has now revealed its, what do they call it, a roadmap, but it's going to be very slow. Those restrictions are going to be lifted very slowly. And I am supportive of using data at every point in those restrictions to see what's happening and to make sure that we don't get another surge. There's no way any of us want to go back into lockdown, and we definitely don't want to see those death rates rising again. Very quickly, one final thing before I stop talking and get to the important part of the questions is that even though the UK rollout has been absolutely fantastic for vaccines and it should be celebrated, and the NHS, the amazing staff, should be congratulated, and the systems are fantastic, they're really good, and we should be incredibly proud. We also need to remember that this is a global pandemic, and that, as somebody wisely said from the WHO, we're not going to end this pandemic anywhere until we end it everywhere. So with that in mind, I just wanted to highlight an initiative called COVAX, which is a global initiative led by the World Health Organization and Gavi, the Global Alliance on Vaccine and Immunizations, and other partners. And they basically have been coordinating a global approach to make sure that across the globe, those that are most at risk are getting priority vaccinations, and also that we can end this pandemic globally. And a quick update on that is that yesterday, 600,000 doses, the first batch from COVAX, arrived in Ghana, a country close to my heart because I work there and do public health programs there. So 600,000 doses arrived in Ghana of the AstraZeneca vaccine. So that's the first step through COVAX of rolling out a global solution. And it's really important for us to remember that we must celebrate what we do in the UK, but we must end this globally.
The resident has asked me to ask on their behalf, and if I could address this to Karen, please. And the resident says, I'm terrified of needles. Can the vaccine be given in any other way, or is there something else that I can do to help my immune system? It's quite common, actually. Lots of people coming in saying, oh, I'm frightened of needles, and often it's people that are quite unexpected, really, saying that. So over to you, Karen.
Usually having lots of tattoos, but never mind. Yeah, this is actually a really good question. Well, there's two questions here. In terms of being able to have it in any other way, not yet, but they are looking in the future for the possibility of nasal sprays or even tablets. We already give children the flu vaccine via a nasal spray, so it's not impossible, but that doesn't get around their current fear. I did do a clinic on Saturday where a young woman with learning difficulties was very, very scared, and it took me 15, nearly 20 minutes to persuade her with the help of her mum. So we did get there, and I understand the fears, but we are very supportive, and we will take time if there is that fear in having a vaccination. But at the moment, there's no other way of having the COVID vaccination, but you know, maybe in the future.
Karen, would you like to just say a little bit about our outreach programme? Because Karen and I, we both work in a surgery, which is a dedicated surgery for people that are homeless and insecurely housed. And we were very lucky to be supported in the decision quite early on to actually take the vaccine out into the community, which was at an early stage and was quite innovative, really. So I don't know if you want to just say a little bit about that, Karen.
Yes, we're very lucky to be supported by our practice manager and senior GP, and they enabled us to take the vaccine out to the homeless insecurity house, which was including the temporary accommodated who are in our B&Bs or hotels and hostels around the area. And we arranged for a centre in the morning to have all the temporary accommodation patients come with the work of the outreach workers from the council. Were absolutely brilliant. The response was absolutely amazing, and they came, and we ended up doing about 60 in the morning who were in temporary accommodation, and then we moved on to the projects where perhaps they are a little bit more nervous about coming out or have lots of reasons for not wanting to leave their room even. And again, we had an amazing response, and as I say, by the end of the day we had done 100 vulnerable clients, patients, whatever you want to call them, and that really, really was impressive. I wasn't expecting that, because quite often trying to even get them in for a flu vaccine or even offering them a flu vaccine in the project doesn't work. So tremendous amount of work done there, and it does prove if you take it out to the community and with the support of all the staff, then it can actually get to far more people than perhaps trying to get them into these hubs. So yeah, we could learn from that, I guess.
And I think it was much less frightening as well, you know, especially for anybody who's nervous, to actually have the vaccine in a very familiar setting rather than being a clinical, you know, waiting for a long time in a queue, as Anna was saying, and then going in and lots of people in masks, and all really quite intimidating. And having the help from the outreach team was invaluable. As Becky was saying, they're very much the leaders. They are the community leaders, aren't we, that we look to help us.
I think also knowing has helped, because they are, you know, reluctant sometimes to engage, but because a lot of them have known us over the years, and perhaps the outreach team and the project staff of Turning Tide, that encouraged them, I think, because they knew us. And that might also help, that if you go with somebody like our last speaker said, if you go with somebody you trust and who can support you, you're far more likely to attend, or perhaps we should go to them.
What do you think that we can do to reduce sort of vaccine hesitancy and also to reduce those sticky rumours that just won't go away. So Becky, I'll go over to you first, maybe.
Oh, wow, Sal. Sticky rumours, you know about those. I think we've all seen over the past 12 months that the importance of clarity of message. So I think we all know that we're all human, we're only human, and that people make mistakes, and that sometimes people make decisions and actually they make decisions and then think, actually, I should have made a different decision. But what people really need is clear communication. So it's a well-known fact, particularly for people like me who have adult brains with kids and all the rest of it, that we can't take anything more than 3 facts at a time. So I think when you're trying to clearly communicate with people, no more than 3 things for their brain to take in. And I know that we've got several of our lovely counsellors here and GPs and nurses and people that are listened to in the community. And it is another true fact that people actually do listen to people who, you know, have a voice for the community or within the community. So I think the more people that can say the same thing, you kind of magnify that simplicity of message. And you know, that's sort of, we've all seen the Twitter effect, right? So, you know, you get a sort of falsehood and you amplify it a few million times and it becomes the truth. Well, how marvelous is it to actually amplify the truth? So a really simple message, you know, amplified by those of us that have a bit of a platform locally. I really sincerely hope that nationally, those simple but very strong messages about the safety of the vaccine, the effectiveness of the vaccine, the data behind the vaccine, and now the statistics as to the effectiveness of the vaccine. We just need to keep those messages simple and strong, and, you know, give people clarity and hope, so that they can, you know, be confident that they're lifting restrictions cautiously and that having the vaccine is a good thing. So for me, it's simplicity of message and straightforward messaging by everybody, really, whether you're on Twitter and messaging or whether you're sort of speaking to more people.
Brilliant, thank you, Becky. So, Rob, have you got anything to say about persistent rumours that refuse to die?
Well, it's just education on an opportunistic way. So when a patient comes in and they say they don't want the vaccine, you explore that with them. They may have a very good reason why they don't want it, and then you can give them some facts, and then they can decide whether they want it or not. That's the best you can do.
Karen?
Yeah, I agree with Rob on that. I think we just need to be very careful if somebody is very worried, just to explore what their worries are. You know, that we might be able to talk it through with them, and rather than sort of making them feel uncomfortable about their thoughts, we sort of accept that there are these sort of thoughts, rumours around. What's worrying you particularly? Can I help you through it? And making them feel that you're respecting their current beliefs, but are also then willing to hopefully talk it through with them and encourage them to consider, you know, what we're saying, and hopefully they'll take that message home. But we did actually have a patient where she's had the vaccination. She's in her 60s and she has not told any of her family, because they are all anti-vaxxers, and she's had to keep it secret, which is so sad. But so it's not just the young people, some people, but I do think we just keep talking to them and keep listening to them and trying to understand where they're coming from, and probably, as you say, give the facts. Maybe we'll make it, you know, make an impact, but maybe one by one rather than trying to do it necessarily through social media sometimes.
Absolutely, thank you. So, Henna, did you want to ask a question?
Trying to use this computer. Hiya. What I was just going to say, you know, like how it's in BAME community, there is a lot of rumors going, and people are really, some of them are really afraid of getting this vaccine because they've been told that there's some kind of animal testing in that, and because of the religious beliefs, people are really scared of. I haven't heard much in Worthing, but there are a lot of rumors are going around, sort of like in London and elsewhere where there's a big populations. So is there like any informations where, for example, if I get anyone from here who's worried, what sort of message or what can I say?
It's a great question, Henna. Sorry.
So they're going to need to have somebody they trust. So as Becky suggested, it's probably aiming at the leadership and seeing what their views are and seeing, are they happy to promote the vaccine as a safe thing, the way they've sort of been doing according to Channel 4 News in Birmingham. where there was initially a lot of reluctance, and I don't know how well that's working, but it looked like it was having some positive effects. So it's just going to be education, but there's no good somebody turning up and saying you must have this. It needs to be somebody they respect and who they're going to listen to.
Definitely. Becky, did you have anything to add there?
Yeah, no, Rob's entirely right. I think it's also a case of that are lots of resources out there, Henna, and resources now in different languages as well. So if you do need any, or if you hear of any other communities, oh, there you go. So I can see Shepo is posting things. I think they were pretty slow to do it, to be honest. I remember there were some issues around translating some materials, but I think they are there now. So so if you do hear any, we can try and signpost and look them up and stuff. So there is a lot more out there. But Rob is completely right. And yeah, sometimes if those rumours become very sort of real to people and their truth, then sort of trying to speak to people about that needs somebody that they trust, for sure.
Yeah, the funny thing is people are, these rumors, and people are making funny videos and stuff like that and scaring people. And people are believing in that and they're listening, and they are sending it to me as well. And I'm just telling them, please don't. You're just putting these mixed messages to the people. This is not right. Okay, so you can't just go around and knocking on those vulnerable BAME people, basically, saying that, oh, you shouldn't be having, do you know what happens after you have this done? You will lose your beliefs and this and that, and you shouldn't, and stuff like that. And it's scaring people. And they're actually sending me saying like not to have. And they say, oh, make sure you don't take the vaccine because it's not good for us. And this is just like unnecessary panic in the community.